All righty. Hello, hello. Here we are. I realize people may be like logging in or joining us on this live feed. We are very, very grateful to be here. It's an honor to be able to be um, here in another heart-to-heart conversation as we are in the Mental Health Awareness Month of May 2022. We are very grateful once again to be here. When we first started these heart-to-heart conversations, it was in the beginning of the pandemic. We wanted to still make sure we stayed connected to the community, and here we are. It's been 2 years. The first initial one was in April of 2020. And now here we are, May 2022, and we are still continuing with these heart-to-heart conversations. The intent behind this topic on mental health awareness is to provide resources, also awareness, but also education to the community in regards to something so important for us, which is mental health. We realize that this month of May, we are dedicating it to mental health awareness. However, as mental health professionals, we dedicate our year round to addressing mental health needs and issues and wellness and so forth. So just keep in mind that we need to complete some ethical disclaimers that as much as this community presentation is to provide resources, it does not replace any form of psychotherapy, any form of assessment or consultation. If you feel or you believe you are in need or someone else, by all means, please consult with a licensed professional in any mental health capacity so that you can actually receive those services too. The other thing too, as much as we are making this open to the community, just keep in mind that your participation, which is welcomed, it wouldn't be private. So any comments or things that are asked or kept in the feed, it would be available to whomever has access to our page or the stream as well. Without any further ado, we are very proud to be having here. We're all joining forces together. This is Counseling of El Paso. This is our clinical team. We'll go ahead and be introducing ourselves. My name is Jasmine Silva. I'm a licensed professional counselor in the state of Texas. I am what we consider a mental health counselor. I'm also a registered play therapist too.
My name is Elda Step. I am a licensed professional counselor in Texas and also a licensed mental health counselor in New Mexico. So I practice on both states. I'm also a certified anger resolution therapist and a certified grief specialist counselor.
Hi, I'm Zoe Olivo. I am an LPCA, so Licensed Professional Counselor Associate here in Texas, and I'm a mental health counselor here at Counseling of El Paso.
And my name is Guillermo Castañeda. I'm a licensed professional counselor and supervisor here at Counseling of El Paso. I have a Texas state license.
Mm-hmm. Mr. Castañeda. Mr. Castañeda?
My name is Guillermo Castañeda Sr. I'm a hypnotherapist here in Counseling of El Paso. I'm also a psychologist in Mexico.
And hello, my name is Angela Barraza. I'm a licensed professional counselor for Texas, and I'm a mental health counselor here at Counseling of El Paso.
There you go. So thank you. Thank you to each and every one of you, because I realize that there's a lot of resources, a lot of knowledge and wisdom that you'll be able to share to the community. We'll go ahead and get started today by addressing a very important topic in mental health awareness, which is mental health stigma.
Yes, it is very important to understand the reality of the mental health, because when you talk about mental health, you almost automatically think of a problem that creates shame. It is not understood that mental health involves a lot of concepts, that its problems do not necessarily mean illness. However, for a good number of people, they talk about madness. And that's not true at all. The simple fact of visiting a counselor, a psychologist, a psychotherapist is a sign of madness or mental illness. That is why it is very important to understand that mental health allows us, among other things, to face the stress of the life, to be physically healthy, to have healthy relationship, to contribute significantly to your community, to work productively, to reach your full potential. It is very important to understand that because we work with people and several people, no, I'm not madness. I don't want to talk about my own life with a stranger. It is not a good reason, because you need to know more about yourself. When you are unhappy, when you are stressed, when you are not enjoying the things of the life, you need you have a mental health problem, but you're not mad at all. It's just, and you need just an adjustment, just it. Then think about it. Think about the mental health is not a shame.
That's right. And like Mr. Castañeda is explaining, that feeling that there is something wrong with us, or that negative labeling can create, like you described, feelings of shame, and we might be less likely to seek support or help if needed to. But that's right. So that's a very good point, Mr. Castañeda, that you bring up about mental health stigma too. I will share with you along the lines in the mental health world, there are different ways of approaching mental health. And there are two models that are very common, and we wanted to introduce them to the community. Sometimes individuals might either conceptualize or see their perspectives from two lenses. They are both equally important, and there's room, and there's an appropriateness to both of them as well, which is the medical model. The medical model focuses on what the issue is, the problem. And it's an important one because normally what happens is that it allows individuals to be able to name the condition or the cluster of symptoms or syndrome that we might be experiencing. In some cases, it can feel very, very validating to be able to say, this is what I'm experiencing, and this is the modality, or these are the ways that I can address it. And normally when it comes to the medical model, it's a problem that is occurring, and then being able to reduce the symptoms that might be having some impact on our daily functioning, might be having perhaps a negative impact on our mood or social or even work components too. And it's an important one. And the medical model too, there are also solutions such as medication management, certain types of treatment or therapies that are recommended usually too as well. And it's an important one too, because it helps us be able to understand what we might be experiencing. Now, there's another model too that's important, which is the wellness model. The wellness model is known for its holisticness. A lot of the times you might hear things like treating the whole person, spiritually, emotionally, body-wise, in all of the domains, relationally. a lot of the times the wellness model also focuses on prevention too, preventing any symptoms that might lead to changes in mood, changes in energy, in daily functioning that might be interfering with how we feel. However, also the wellness model focuses on wellness, like it says. It focuses on, well, what brings us joy? What brings us things that make life feel good? So the medical model helps reduce any distress, the intent is to serve to reduce any negative impact that it might be having. And then the wellness model also serves to see, okay, now that this is stabilized, we feel like we're doing, this is no longer having that negative impact. Now, let's bring, for example, like Mr. Castañeda was saying, that maybe satisfaction, purpose, meaning, joy, whatever it is that the person values that would bring a level of satisfaction to their life too. So we wanted to share this too, because a lot of the times individuals might be having conversations with one another, and either or we might be thinking about it from one or the other, and there's no right or wrong answer. It just depends on what is appropriate for the individual too, and then what resonates with them as well too. However, there's room for both too. Also, on that note, it also depends also on how the provider, the psychiatrist, psychologist, licensed professional provider might conceptualize too. Like I said, they may have both perspectives or one or the other. It just depends too. Yeah.
To kind of add to that, one of the things that's really important is that everybody finds fascinating at some point or another are the diagnosis, right? Especially when something doesn't seem right, something seems off. One of the things that, before we jump into that, is very important to consider that, those people that have diagnosis, the idea or the concept that, if I have a diagnosis, it means I'm broken. It's very important to consider what that means for you. What does it mean to be broken? Does it mean that I don't work anymore? Because remember, kind of like what Jasmine said, we're whole. We're an entity of an individual. We're not just parts and bits and pieces, right? We're not a machine. A machine breaks and we try everything we can do to fix it. But once if it doesn't fix, we throw it away. That doesn't work with us, right? We're not broken. There are things that are missing. That's okay. Let's find out what's missing, right? Instead of looking at it as I'm broken, maybe looking at it as a puzzle piece. Okay, what am I missing, right? Oh, I'm missing a little piece of joy. I'm missing a little piece of self-care. I'm missing a little piece of socialization. Okay, well, let's go find it. Let's go get it. Let's make it into a whole, right? Again, we're not broken. And, one of the major diagnoses, right? I'm not going to go into all of them because there's an entire book that's yay big that talks about diagnosis. We'd be here for the next week or so. I don't think we want to do that, right? But one of the main ones that come up a lot and we use, and we can be very inconsiderate sometimes when we just throw them out there. For example, PTSD, right? We need to be very mindful as a community about, when we say things like this. Oh, well, I just got PTSD from, a car passing by. It gave me PTSD this, it gave me PTSD that. Be very mindful because remember, it's much more complex than that, right? What does it mean to have post-traumatic stress disorder, right? It means that you've experienced or somebody close to you has experienced something very traumatic, something very harsh, right? Something that's shifted within the sense of safety. In other words, somebody that has experienced trauma, experienced unsafety, right? I'm not safe in my environment. I'm not safe with myself, right? So then I'm starting to have these triggers. I'm starting to have these issues, right? And I feel unbalanced, right? We need to be very mindful also of that because, that's a very sensitive concept in of itself. And when we just kind of throw things, we demean it, right? We demean its importance, its, the value of the individual that's going through the trauma, right? And another thing that is very important, especially when it comes to trauma diagnoses, right? And any type of trauma diagnoses, is everything that comes with it, right? We think that PTSD or post-traumatic stress disorder is one thing, anxiety is another, depression is another, and so on and so forth. And a lot of times it's all clumped together. Think of it like an umbrella, right? PTSD is the umbrella, and underneath it are all these other symptoms: depression, anxiety, anger, isolation, dissociation, some psychosis, right? Some OCD, right? Obsessive compulsive disorders, right? All of these other things are underneath this big umbrella, right? And whenever we come across somebody that's just giving us like 12 different diagnoses, maybe it's taking a step back and considering, okay, is it this big umbrella or is it really each and every one of them, right? Sometimes they come up as personality disorders like borderline personality disorders, right? We need to be very mindful of those things. Another important one is bipolar disorder. Oh no, she's so bipolar or he's so bipolar because his moods shift from back and forth. Moods shift. We all experience mood shifts. One day we may be very happy, another day something just did not work out well and we're a little upset, right? Does that mean we're bipolar? No, right? Bipolar is so much different than that, right? There are the highs, the high energy, and then the low, really, really depressed, right? OCD is another one that we like to throw around, right? Oh no, I'm just so OCD because things have to be organized. We live in an organizational ideology, right? Things have to be organized for us to be able to see, okay, you know what? I can do this. I can work with this. I can set goals. I can do this. Doesn't mean we're OCD, right? OCD, obsessive compulsive disorder, will cause a lot of distress and anxiety, so much so that it disrupts daily life, right? Just because, you know, something is disorganized in your daily life doesn't mean that, you know, you're OCD, right? And it's something to be very, very conscientious about as we talk about these diagnoses and being very empathetic with each other and being very empathetic with others that do have some diagnoses.
I think that's a good point. That's very important to come up with the right diagnosis. And just to add a little bit to that it's important to see the whole thing of what constitutes diagnosis. For example, with the PTSD, and that is something I like to say because people say, for example, well, you have depression, you have anxiety, you have this, you have that. And instead of seeing the whole picture and saying like, well, you know, everything, PTSD has depression, anxiety, you know, anger, you know, nightmares, a lot of other things. So wouldn't, instead of telling a person that they have like 5 diagnoses, wouldn't it be just better to tell them they have 1? And this is just like telling a person like, well, you have an arm, you have legs, you have your trunk, you have everything, but you don't have a body. I mean, pretty much you have PTSD. It constitutes everything. So it's really important to get the right diagnosis, because that, you know, will depend on how you treat a person. Even what kind of medications they're going to get if they go that route. And so how do you treat a person is the question. What kind of counseling are they going to get? So there's different kind of modalities that it's important to understand that they all come from a different way of human development or how a person works. So for example, people like to say like, well, I look at one type of modality, say for example, CBT, and that's pretty much all I'm going to use. I'm going to do an eclectic kind of treatment for that person, and that means that
I just wanted to clarify. You're referring to professionals, mental health
that's
professionals, correct?
Yeah, that's correct. Yeah, so counseling modalities, because it's important. There's many modalities in the physical therapy world, or there's many modalities in the medication world. But yes, as far as counseling modalities, you know, it's important to say what is it? Where am I going? What kind of counselor am I looking for? Because even the modalities are not useful for every diagnosis. So sometimes you'll find a therapist that will go under eclectic modality, like an eclectic modality, which will basically constitute a lot of little bits and pieces of modalities that are around. Sometimes we're looking for more of an integrative modality, which is like 2 or more specific modalities. But we also need to understand that there's directive and non-directive modalities. So non-directive are also those where the counselor will take a step back and will allow the client to kind of just, have their own, look for their own way. Directive is a little more like helping them, although the client is going to do their own work, but it will be more a little bit of homework-based modalities. So different types of modalities, and I think every one of them should have some kind of client-centered approach. But the client-centered or person-centered counseling is the one that is based on 3 core conditions, for example, empathy, unconditional positive regard, and congruence. So that means, for example, that in this from Carl Rogers, for example, empathy, that I'm going to imagine myself in the client's position. What kind of like put myself in their shoes, and not be judging, which goes to unconditional positive regard, to have that warm way of treating the client regardless of what is it they bring to the table. If they have some kind of issue, I'm not going to go like, oh my God, I can't believe you're having that or you're doing that. It's kind of like our values, our morals stay outside the door, and we treat the client that way. We also need to have congruence, which is honesty and openness. So I'm going to be honest with the client. I'm going to be open up to a certain point. And that's going to get the client to trust the process. There's also, for example, existential counseling, which, we're going to clarify and think about and understanding life so that they can live it well. So what's going on in your life? What is the purpose? What are you looking for? What kind of existence? What's up with your existence? We also have, for example, Gestalt, which is a little more of a directive. So I'm going to have a little bit more of an active awareness of the present situation and what kind of communication am I having, without the words. I don't know if anybody heard of, for example, dramatization or acting out different conflicts in life. Then you have cognitive behavioral therapy, the one that's a little bit more directive, but again, we all go with the client's, I guess, centering everything around the client and not telling them what to do. That's really important. So we look at how the beliefs actually will impact a person's reactions. What are their thoughts? What are their feelings? How do I see the situation around me? There's also brief therapy, which is around 4 or 5 sessions. And that one, I don't care what happened in the past. I don't care what's happening. I just care about what's going to happen, what's happening right now, and that's it. Just the goal of it. And those are the most popular. Psychodynamic. I'm going to look at the person's past and those experiences. How do they work with the present? What were their relationships like in the past, maybe in childhood? And that's what I'm going to be working with. So it's important to understand that there's hundreds of counseling modalities. But for example, certain modalities will not work with certain situations. If I have talk therapy, and this is something that we learned very well from The Body Keeps a Score. I'm sorry, I butcher his name all the time. So if anybody wants to help me out with that one.
It's Bessel van der Kolk.
There you go. So if there's one thing that he mentions is, for example, if you have trauma, if you have complex trauma, if you have PTSD, you don't treat that person with talk therapy because their brain is kind of stuck in the moment. And if you open it up, if you have them retell the story over again, the brain will actually take them to a past. So you want to make sure that you have a modality that's actually going to keep them in the present, looking at the past. And so different things for different situations. For borderline personality disorder, you want something that's more dialectical based. And so you really need to see, and this is for the counselors to understand, that not just because they are well versed in a modality, that they cannot look for other kinds of tools in their toolbox to treat an issue. And this is for the clients to understand that if something is not working with the therapy, maybe it doesn't have to do with the counselor or even the therapy. It might just be the modality that is used.
Absolutely, Memo. I do agree about how the therapy modalities are super important to be aware of, especially as a prospective client looking into therapy, seeing if that's an option for them. Kind of going off of that, I wanted to kind of direct it more towards the topic of finding the right therapist and what that process looks like. So where you end up going for mental health treatment is really dependent on your situation and what you want for your recovery. So there are many ways of receiving therapy. There's many types of centers. There's community mental health centers. There's private practices. You could go to a university. There are so many different options, but really at the end of the day, there's a lot of downsides to some of them and a lot of pros. So for private practices, there is a lot of pros that you get to work one-on-one with a therapist, maybe with multiple therapists. It really depends on kind of this weekly, biweekly, or monthly progress towards managing your symptoms and reducing behavior regressions. In the case of community or county mental health, they provide multiple services like outpatient services, medication management, case management services, and even intensive community treatment services. So while those are great, they may not be suitable for everyone. So finding out what is going to be suitable for you. A downside to private practices is they may not typically offer medication management. You'll have to be referred out. So if that's something you want in-house, maybe community mental health is more your pathway. If you prefer picking your own therapist, typically that's not something you can find in a community mental health center. So maybe private practice or going through a university, all those different types of options may be more suitable for you. As far as starting to find a therapist, there are some questions I want you to start considering, like what type of therapy would you like to receive? And that goes off of what Memo was mentioning about this therapy modalities. What do you think might be best for you? Do they accept your insurance, your health plan? Are they private pay? Do you prefer a certain gender, fluency in language, age, race or ethnic identification, degree or background? Also, do you prefer in-person sessions or do you prefer telehealth? Kind of like what we're doing through Zoom right now. So these are really good questions to start considering before deciding on a therapist. A way that we can start searching for them is we have a great resource through Psychology Today. They allow you to search for your therapist based on your zip code, and then you can even filter those search results for their gender, insurance, specific pricing, and other specifications. And within each of those therapist listings, there's actually a lot of information that therapists can provide, like their education background, specialty trainings that they've done, years of experience, the therapy modalities that they use, like population and technique specialties, the fees they may require, the office location, and right there, they typically say if they are doing telehealth, and also a biographical statement. So describing a little bit more about themselves and how they got there. And once we start working with a therapist, it's very important that you don't have to settle on a therapist just because you go for the first time. So once you show up to find that therapist and you show up to the appointment, maybe start asking yourself, like, what is the waiting room like? Is it comfortable? Is it noisy? Is the therapist on time for your appointment? How do they greet you? Do they let you know where to sit? Do you feel better or worse at the end of the hour? And that can depend on your situation and everything. I do want to put that disclaimer there, but also it's important to recognize how you feel with that therapist. Do you feel like they can listen and connect with you? Is this someone you feel safe with? Can you trust that they respect your vulnerability as much as your strength? Do they seem like real people? So again, all of these answers are subjective, and it's really up to you on what you feel most comfortable with. So also remembering, kind of like what Memo was saying with the therapy modalities, is that while a form of treatment may be helpful for one person, it may not be helpful for another. So if you heard and you were recommended to a therapist by one of your friends because they go there and it doesn't work for you, it doesn't mean something's wrong with you. It may just be that that's not the right therapist for you. So along with that, remember that you can decide to pursue another therapist if this one isn't the right one for you, regardless if you determine that after the first 5 minutes or after months of sessions. You have every right to find another therapist if that's what you would like to do. Additionally, if you are feeling like this isn't the right therapist for you and you want to continue searching, if it's possible, please do. I really hope that you can find another therapist that is more suitable for you. There are plenty of us in the area and across the country. As far as therapy goes, once you find a therapist and you start becoming a part of the therapy process, there are a few expectations that need to be discussed as far as like what we've heard as therapists and kind of clearing the air on that. So typically when our sessions first start, there's going to be focused on assessment. So questions like what is going on? What is the severity of those issues? What can the therapist do to help you? And what do you expect the therapist to do to help you? Also, what goals at the end of the time do you want to be working on? During this phase, it may not feel like therapy is typically occurring just because the therapist is going to be asking a lot of questions. And this doesn't necessarily mean that therapy is not happening. It just looks differently during this stage. Additionally, one thing that I hear a lot, and I'm sure the rest of us have heard a lot, is that therapy is like receiving advice. And I wish we could give you all advice, but that's typically not what we do. In reality, therapy is more of a process of us guiding you to use certain tools and skills that you've acquired along the way or that you already have within you, so you can gain greater insight on yourself and accomplish those therapy goals. So that's basically what we mean when we say we're giving therapy. Additionally, therapy is not typically going to produce immediate results. So it is going to be a while, probably more than a few sessions before you start observing tangible results, simply because it's going to be a progress of many small behavioral changes, thought pattern changes that eventually lead to bigger change over time. So it is something we need to constantly work at and invest in.
So there are many components when it comes to mental health. I mean, Elda talked about diagnosis, they talked about therapeutic modalities, and definitely, you know, who you attend therapy with, what therapists you have, and that just the whole process, right? There's so many different components, but it's also important to remember that you are definitely not alone in this process. And like Zoe said, it's definitely, it'll take a little work, right? But every single step counts. From the step to just sharing with somebody that you feel like, okay, I feel like I need to talk to somebody, or I feel like I might need a little help dealing with some issues that I'm experiencing, to actually going maybe on the internet, you know, maybe using Psychology Today, looking for a therapist. So every single step counts. Your first session, you know, pat yourself on the back for being at that first session. So every single step is important. It's definitely not a process that's going to happen overnight or, you know, within a month. It's, you know, our mental health is important, and it is something that we will be working on for our whole life. Mm-hmm.
That's right. And like everyone here has been sharing, our message here for you, for everyone, especially for the community, is one of transparency. We're sharing lots of information in regards to even how to select, how to choose. Well, how does this work, right? And then also hope. Empowering, and in our own way also a form of advocacy too, to be able to share, like, okay, there are ways, there are options. I love this beautiful quote in regards to provider and modalities. It might not be for everyone, but there's somebody. It will be for somebody at the right time. And keeping in mind too that in different seasons, maybe something might have worked before, and then in a different season of life, maybe we need something different too, as well. We really want to thank everyone in the community for joining us. We are so grateful to be here in this platform and be able to connect with the community, and also share all of these resources and tools and knowledge, nuggets of wisdom that might be of help or service too. Before coming to a closure, does anybody else want to add something?
Yeah, well, I just wanted to mention about Counseling of El Paso. It is a private practice, and we do have wonderful therapies here. We have we go from person-centered, client-centered, to we have a registered play therapists. We have professional hypnotists. We have eclectic. We have anger management, grief therapy. We pretty much, we have a lot of therapies here. Our number is 915-209-1234. 915-209-1234. If you would like to make an appointment. We serve the community. We do child therapy, family therapy, individual, couples therapy, like I mentioned, hypnosis. And also our website is www.counselingofelpaso.com.
We will go ahead and also share some resources on this feed for, in the case that you, and for whatever reason, you're experiencing a form of a dire need or an immediate help or a form of a crisis. We'll go ahead and share those as well, that so you can have immediate access to a provider in the case of an emergency as well. Once again, thank you so much. We're very grateful. Like Guillermo said, you can find us on our website, or we're a phone call away. And once again, thank you so much. We're very grateful to be here. If you want to share this, we will be having the Spanish heart-to-heart conversation 2 weeks from now as well too. We'll be sharing that también. Thank you so much. It was good seeing you, y nos vemos pronto. Thank you.
Thank you.
Bye.